Hey y'all, and welcome back to Reed's channel. Today I wanted to talk about some of the breathing difficulties that kids with Krabbe go through. One of them being the salivation. So one of the side effects, and I think I mentioned this in another video, but one of the side effects to Krabbe is actually excess secretions. And they tend to drool a lot, and they tend to salivate a lot, and it causes them to become really congested and backed up sinus-wise. And actually, pneumonia is one of the contributing factors to death. And so you have to be really careful, and you have to watch their upper respiratory systems quite a bit. One of the drugs that they prescribed to us for Reed was atropine. And basically, you give 1 to 2 drops every 6 or so hours, and it's supposed to kind of cut down on their secretions so that, they don't aspirate on their own saliva, and it definitely decreases the risk for pneumonia. And as the disease progresses, the salivation gets worse and it becomes more of a battle. And so sometimes the nurses will also give you, we work with hospice a lot, and they prescribed and dropped off a suction machine, and also I think it's called a nebulizer to give oxygen, just because they already knew, going down the road that we would have problems with this. And it's heartbreaking to report that has become a huge issue. He has been salivating more over the past, I would say, 2 months, but last night just really kicked off like just a huge episode for us. And it's been an emotional day. It's been a really just heartbreaking day, just knowing that that his disease is progressing and that it's going so fast now. And we're hoping, that like he'll plateau, but we just don't know yet. So last night we thought, I still think that he's been sick. I think that he's had like some sort of cold for maybe the past few days, and we've definitely been on top of it, talking to hospice and discussing it with his team just to make sure that, we're doing everything we can at this time, and just kind of like what to be on the lookout for. And so we've definitely been paying attention to it. And they prescribed Robifen, which is a decongestant, and it's also like a cough syrup. So we've been, as needed, we can give him 1.25 milliliters. I'd have to look at the label again, but we write down all of his meds so that we keep track of like every single milliliter he gets and what time. And that way we know that, there's no risk for ODing him, or that his medications aren't going to interact with each other. And that's something that I would definitely suggest any parent who is dealing with a chronic illness, like go to the Dollar Tree, get a little journal, and just document date and time of every medication they get. And we also write down every ounce of formula he gets. I think the only thing we don't write down is water, because we are pretty well able to keep track of that based on his formula feedings. But so last night, he's been congested for a few days, and then when we laid him down, we noticed that he just was really just extra raspy and really just sounded really congested, and it concerned us. But we gave him the atropine, and it seemed to dry up some of his secretions. And we went to bed as usual, and then we woke up. Well, I guess Reed woke us up probably about 6 a.m. this morning, and he was just really congested, and you could hear like the raspiness in his breathing, and it sounded like he needed to cough, but he didn't have, he can't really have like a productive cough where we can get phlegm out of our throats. He really can't at this point, hence the suction machine. So we hadn't had to use it until today, and then Will was out running errands, and I was at home with Reed, and Reed woke up from his nap, and it just got even worse. And his secretions were more, and he was in pain. So I just tried everything under the sun. I tried picking, which he's getting really long. Like I'm about 5'7". Reed is about 3 feet. And he's getting heavy. And so for me, he kind of takes up like the majority of my body. And so to hold him up on my shoulder is getting more and more difficult. But I tried that, and I sat down with him and hoping that it would either drain or that it would make it easier for him to breathe. And that didn't work. And he had so much saliva that he was able to blow full bubbles and was foaming. It was just really bad. So I tried a ton of different positions and tried patting his back and just anything to break that up, and nothing was working. And so finally I got out the suction machine, and which is really hard to do with one person, by the way. It's just really, as they get bigger, it gets harder to hold them in one place and then also suction at the same time. But I tried it, and it seemed to work a little bit. And I got some of that stuff out of his throat. And so I was like, okay, well, maybe things will, like, his pain or his being uncomfortable will kind of subside now. And it didn't. And so for probably the next hour and a half, just tried everything, that I could give him without just, like giving him too much of anything or giving him too much of a combination of everything. And just nothing was working. And ended up waiting the appropriate time and then gave him more atropine and tried to suction again. And then when Will got home, we agreed that we would give him the Robifen, which is the decongestant. And still, so now we're in it probably 4 hours at this point. And still, he just seemed like he was in pain, and he was super uncomfortable, and still just had so many secretions. Like, every burp cloth I would use would just be soaking wet, and then some. Like, it's on my shirt and on him, and it was bad. So we agreed to give him the Robifen, and then within, I would say, maybe an hour, he was ready for his nap. So we laid him down, and I think that was about the time that the atropine and the Robifen started working. And his airways seemed to open up, and he, stopped salivating as much. The only, I would say, negative to the atropine is that it makes them really sleepy, and it lasts for a long time. So we try to not give it as much as we can, but I think that we're getting to a point that we're going to have to start giving it scheduled, because I think by trying not to give it, we're allowing those secretions to build up to the point where they become like too much for him to clear. So I think I need to talk to hospice about it. And I know that everyone builds up, every body builds up a tolerance to drugs at some point. And so I'm hoping that it'll get to the point where he builds up a tolerance enough that the super side effects of him being sleepy will dissipate, and then he'll still get the benefits of the drug. But I need to talk to them about that. We've also tried, I want to say it's hyoscine. I'd have to look at the label again. That one, though, didn't work at all to dry up his secretions. It didn't help. So we kind of wrote that off. So I think because everyone's body chemistry is so different, at some point, you're kind of caught in the cycle of experimenting to see what works best for your child's body chemistry. And that's kind of where we're at. And I think we have a better idea of it now, of what's working and what's not. But it's definitely been like 3 months of trial and error. So, during that time that nothing was really working, we stay in contact with hospice. And, we were kind of instructed to definitely go to hospice as our first line of communication. And then if it's an absolute emergency, like they're not breathing, or, if it's a 911 call, call 911. But everything else, we definitely go through them. And I love our hospice nurse. I think she's amazing. She's so kind and just very good-hearted. And we're very fortunate to have her on our team. Reed is very fortunate to have her. So we contacted her and, explained what was going on. And she suggests cutting back fluids a little bit to see if that was part of the problem. But I kind of think that it's like a cold. So she offered to come out tomorrow and, we're definitely going to keep in contact with her tomorrow, and if need be, she'll come out and possibly discuss with the doctor about prescribing maybe like a higher decongestant or a different prescription to dry up the secretions. We'll just have to wait and see. But thankfully, right now he's doing okay. It's scary because with this disease, you just have no idea like how it's going to progress and which parts of the brain it's affecting. And I think the not knowing is the worst because there's no standard for Krabbe. So it's not like we can say, okay, well, at 18 months old, this other child who has Krabbe was experiencing these things. So we know what to look for at 24 months old. Like, we have no idea. And everyone's situation is just so different, and it makes it very difficult. On top of that is that I guess fortunately not a lot of health professionals have seen this disease, which is a blessing and then it's not, because on the one hand it's such a horrific disease that I'm glad that most of the people we've talked to, and we've talked to dozens of healthcare workers, but doctors, nurses, like just you name it, we've talked to them, specialists, geneticists, the whole 9 yards. And for most of them, Reed has been their very first case of Krabbe. So on the one hand, that's a big relief, because I would never wish this on anyone. And then on the other hand, it's like, well, there's no one to tell us, what to do or what to expect. So that's hard. And, you're kind of just, it's like the blind leading the blind, we just have no idea what's in store for Reed. I guess we have an idea, but there's just no guarantee to what he's actually going to experience, and if he's going to pass away before he gets to that point. Like, we just don't know. So so that's hard. But as far as the breathing difficulties, if you are watching this as a parent of Krabbe and you're just not sure what to expect, this is something that I would say most parents of Krabbe, or I guess most children with Krabbe, experience at some point. That's one of the prescriptions that they prescribe right off the bat, is to dry up secretions, because that seems to be like one of the more common, I don't know if you call it a symptom, but one of the more common things that they'll experience during this, the progression of the disease. So, sorry. So if you are starting to experience that with your child, I would say discuss with your healthcare provider a machine for secretions, also a nebulizer, which we have not used yet. If we do use it, I'll definitely make a video with that. But talk to them about atropine. It seems to work really well, even though the side effects are extreme drowsiness. And they also sometimes get really red in the face. And I would say explore, I think it's called hyoscine. I want to say it's Hyosine or Syne. You'd probably be able to Google it and come up with it pretty quickly. But it's for secretions. It's for excessive secretions. So those are definitely things to look out for. And I'm hoping that this is just a side effect of a potential cold that he has, and not the progression of the disease, but we just don't know yet. So I will keep you guys informed, and please keep us in your thoughts. And thank you for watching.